I'm Katerina Gallus. I'm a plastic surgeon in San Diego, California.
When you are doing a breast augmentation, where do you make the incisions?
So there's 3 locations that you can use to make an incision for an augmentation. The most popular one for me in my practice is an inframammary crease. So it's that little fold right underneath the breast. It's 4 centimeters. It's hidden. Once you put the implant in, you won't see it because your breast will cover that. And I think it makes the most sense in terms of access to do that. The second most common option is periareolar, so around the nipple areolar complex. It's like a little half moon, basically, at the bottom of the areola. That incision is sometimes popular. I try to avoid it unless I'm doing a breast lift at the same time because you're going through the ductal tissue to do that. So there is a theory, unproven, but a theory that it's a less sterile procedure, which, as we know, if there's any contamination of that pocket at the time of augmentation, there is a risk for capsular contracture. Now, we have ways around that now. We use Keller funnels. But when I am doing an augmentation through an IMF incision, I will put little Tegaderm stickers over the nipples as an added protection. And that's from a study that Bill Adams did. So that's one of the 14-point plans to sort of decrease the rate of capsular contracture.
Like getting an oil change.
Yes.
Okay. I think it's interesting that you jumped to preventing infection because where my mind went was, how do you fit an implant through that teeny tiny hole?
So I use a Keller funnel, which is a very overpriced pastry bag. That's what it looks like. But it's brilliant. I have, relatively small hands. I don't have very strong fingers. And so the traditional way of putting the implant in is to shove it through that small incision with your fingers, push, push, push. Again, you're exposing the implant to possible contamination. And so whoever invented, I think Thomas Keller, whoever invented the Keller funnel, God bless him, because you can do a no-touch technique where you take the implant from its sterile container, essentially pour it into the funnel, and then squeeze the end of the funnel into the pocket that you've created and implants in.
It's ingenious.
It is ingenious. Simple but ingenious.
That was 2 incisions.
That's right. I was just... So the third incision, which is one I don't do, but was trained on, is the axillary incision. So that is an incision around the underarm area and traditionally was used to place saline implants because you could get that through the small incision and slide it into the pocket. Also traditionally, and again, the way I was trained, was a blind dissection. So you can't see what you're dissecting. It's done with a certain surgical instrument that's pulling the muscle up for you. There are some techniques using the axillary incision that use a scope. Basically, you're using like an endoscope to see what you're doing. And so people who have trained in that technique use that. But it's a little bit difficult to really access the right pocket from that place. And if you ever need any correctional surgery, you're not going to be able to reuse that incision. So it's a one-shot deal.
And it's very unlikely that you won't need another surgery. Isn't that true too?
Yeah. So I tell all my women that are coming in for breast augmentation that it's not a lifetime device. And it is, especially the younger you are, 100% chance you're going to need another surgery down the road for lots of various reasons.
Now, there's a really strange 4th incision that I want to ask you about because when I started, actually it was before I started learning everything there is to know about plastic surgery, my neighbor was a plastic surgery nurse and her surgeon tried a lot of stuff on her. And at that, I'm talking about like early 2000s, okay? Mm-hmm. This was a long time ago. She had a TUBA, and so he put her implants in through her belly button, and what do they do? Tunnel up through your abdomen, and then
yes. So it's a trans-umbilical breast augmentation. I remember because around that time, Dr. 90210, that show was popular, and he was going to ostensibly do a TUBA, on the show, and he did it through an abdominoplasty incision, which is not how you do it, but that's fine. And that's a whole other ball of wax. But yeah, that has been, there's a few holdouts who do the TUBA, I think. Again, you're using a blind technique. You're going through the belly button, which is not your cleanest body part, and then dissecting up through the abdomen into the chest, and then there's no way you can possibly see what you're doing to set the pocket for the implant.
And that's not very common anymore, that
No.
approach. No. Where can we find you on Instagram?
I am at Restore SD, as in San Diego Plastic Surgery.
Sounds great. Thank you.
Thanks.
Links to our guest's website and contact info are in your show notes. Follow us on Instagram at Where Before Meets After. If you're a board-certified plastic surgeon and would like to be a guest or a sponsor of the show, go to wherebeforemeetsafter.com for more information. Where Before Meets After is a production of The Axis, the podcast agency for aesthetics. THEAXIS.io.